Hi, I am so sorry that I can't be with you today, but the BA.2 subvariant of COVID-19 had other plans for me. I'd like to thank you all for the kindness you have shown me in recognizing my work advocating for vaccines. To receive an award named after such an inspiring physician is an honor that is beyond estimation for me. Dr. Feigen was a giant in the history of our pediatric profession. He was a prolific researcher, an author, a co-author of more than 500 scholarly articles, 15 books, including the definitive textbook of pediatric infectious diseases and Oskey's textbook of pediatrics. His research refined our understanding of bacterial meningitis, leptospirosis, osteomyelitis, and measles. He was physician-in-chief of Texas Children's Hospital from 1977 to 2008 and president and CEO of Baylor College of Medicine from 1996 to 2003. By the time of his passing in 2008, he had trained more than 2,000 pediatricians and pediatric subspecialists. Among those graduates were 2 medical school deans, 22 associate deans, 10 pediatric department chairs, and 180 pediatric section heads. The legacy of his professional life as a teacher to future pediatricians and physician to thousands of patients cannot be measured. So, I must admit to being a little embarrassed to receive the Ralph Feigen Award, given my comparatively modest contributions. If there is one thing I share with the late Dr. Feigen and many of my pediatric colleagues, it is a desire to make a meaningful difference in the lives of the children entrusted to my care and potentially beyond the patients I personally care for. I started my journey on the path to becoming a physician for very idealistic reasons. I graduated from a Jesuit high school in Dallas, where the motto was Men for Others, and the goal of living up to that principle has guided me all these years. I knew that I needed to find a mission-oriented path, and early on realized that vaccines would be my cause. The now discredited and retracted Wakefield paper that was the spark of the modern incarnation of anti-vaccine activity was published in the journal The Lancet in 1998, in my first full year of practice. I watched as the wave of anti-vaccine sentiment swept our country and Europe, leading to outbreaks of diseases that I thought I would never see. I realized that fighting against this and in support of vaccines was the cause I was intended for. But no one can effect meaningful good alone. I count so many mentors and colleagues who have seen more in me than I imagined in myself. I have been encouraged to join others in common purpose and then given the opportunity to lead, which has taught me so much more and allowed me to do so much more. I am so appreciative of the organizations that have given me those opportunities. Texas Pediatric Society, American Academy of Pediatrics, Texas Medical Association, and Cook Children's Healthcare System. I also am grateful for the opportunities over the years to collaborate with the Immunization Partnership in support of policies that benefit childhood vaccines and to fight policies and legislation that undermine them. Most of all, I thank my wife and my practice partners who have gracefully permitted me the pursuit of my mission and my efforts to try to live the motto I learned all of those years ago. Thank you very much.